2020 was a year of unprecedented growth in earned media for the University of Maryland School of Medicine. From top-tier newspapers to national television networks to an array of online publications and platforms, the School of Medicine's coverage by the national media reached a new high. As the COVID crisis unfolded, the national media relied on School of Medicine faculty, physicians, and scientists to provide information about the virus and the importance of social distancing.
If all Americans are wearing masks, is that something you think would slow infections even more?
The people who don't normally wear masks you end up touching your face more, you end up contaminating yourself more. And also, again, the homemade masks don't do much protection. They may limit large droplets, but not small droplets.
Throughout the crisis, the Center for Vaccine Development and Global Health and the Institute of Human Virology have been in the national spotlight. The CVD tested both the Pfizer and Moderna vaccines, helping to prove their safety and efficacy.
Joining us exclusively now is one of the lead investigators in this trial, Dr. Kathleen Newsel, director of the Center for Vaccine Development and Global Health at University of Maryland School of Medicine. Thank you so much for being with us, Dr. Newsel. And first off, just how optimistic are you about the success of this trial?
So this is a virus that we knew nothing about 5 months ago. And the fact that we already have multiple vaccines in clinical trials is cause for optimism.
A vaccine could pass FDA scrutiny late this year or early next. Here's Tom Costello.
At the University of Maryland Med Center today, more volunteers rolling up their sleeves for a COVID-19 vaccine trial, this one run by drug giant Pfizer. Lead researchers say it's critical to enroll minority volunteers since COVID has disproportionately affected those communities.
We certainly aren't out to coerce any populations, but we would like minority populations to have full access and full advantage of participating in these trials if they wish to do so.
Of some 360,000 online volunteers for vaccine trials, only 40,000 are minorities, much lower than their share of the overall population.
We want them represented in vaccine trials so that we can ensure that the vaccine works well in these populations, since they're most at risk.
They say that they could make more than 1 billion doses by the end of 2021. Walk me through a realistic timeline.
By fall, we should be having the phase 3, which means that we might have efficacy proven for some of these vaccines, including the Pfizer vaccine, by wintertime. And that means that the licensure might be sometime during the winter.
Some experts predict there will be at least 2 vaccines for children by next school year, a critical step to restoring kids' well-being.
Think about just how much burden children have taken on with this pandemic. Can't go to school, can't see grandma and grandpa, can't play sports, can't see their friends. All of those things could be turned back upright if we can get these trials done and if the vast majority of our population can get vaccinated.
Driven by the coverage of the COVID crisis, total media mentions of the School of Medicine increased from about 8,500 in 2019 to 17,500 mentions in 2020. The number of mentions by media markets also expanded over the same period of time, increasing awareness, mindshare, and reputation across the country. The renowned director of the Institute of Human Virology, Dr. Robert Gallo, was among the many faculty members interviewed frequently.
If you take an oral polio vaccine as a kid, for a long time, it'll protect you against polio. And maybe if you take it now, it'll kick in a short-term immune response that might protect you against flu or coronavirus. Is that what you're saying?
Exactly. Yes, exactly. We don't know how long this would last. This innate immune system lasts. It's variable in different things, but certainly it would last. It certainly should last for a month, maybe 2 months.
Several vaccines are in the making. In the end, will only one emerge as the gold standard, or will there be several variations of COVID-19 vaccines, Dr. Yunus?
So there are more than 40 vaccine candidates, and I'll tell you, in 20 years of my career, I've never seen this kind of solidarity, this kind of aggressive action towards the development of a vaccine.
School of Medicine faculty also appeared often on local TV news as we supported the state in the fight against COVID.
Dr. Marcosi acknowledged there is some good news despite stubborn problems.
I think really we should put a mark on the wall and say the state of Maryland's goal is to achieve 1% or less in case positivity.
School of Medicine faculty were widely quoted in the digital and print versions of top-tier news publications, including the Baltimore Sun, the Washington Post, U.S. News, the Wall Street Journal, and the New York Times. The School of Medicine's digital impact also increased dramatically on websites, in social media, and in Google searches. Combined reach from print and broadcast news stories increased from 16.5 million in 2019 to 76.7 million in 2020. According to Cision, which monitors earned media, the School of Medicine appeared in media outlets with a combined total audience in the billions. For the University of Maryland School of Medicine, I'm Larry Roberts.